Thank you, Deb. I now give you Jennifer Schneider. Jennifer, thank you so much for being here.
Okay. Hi. Sorry, but I am going to look down at my paper. I apologize, but it's going to happen or else you would all be very sorry. My name is Jennifer Schneider, and I want to take this opportunity to thank you for letting me be a part of this historic moment. Yay. It's going to help make sure every Vermonter gets the care they need, when they need it, where they need it, and at a price that they can afford. Yes, hopefully. As a kid, yes. Yes. As a kid, my family spent many summers in Vermont. We worked hard to get to know the community and took part in town events such as square dancing, town hall dinners, plays, and outdoor activities. This is leading somewhere. While living in Belmont, our summers in Belmont, Vermont, over 30 years ago, my family joined fellow residents in a time capsule ceremony where members of the community each contributed something of significance, creating a memory together that has stuck with me for all this year. I have no idea if it was ever opened, but it's there somewhere. It's kind of exciting. 16 years ago, I decided summers just weren't enough, so I moved to Burlington. I love Vermont, and I consider it my home. My partner and I bought a house and have worked as caregivers in the school system for years. Life was good, and as a healthy individual, worries about insurance coverage and health care were far from my mind, even though my parents were constantly bugging me, you need to have health insurance, and okay, I'll get health insurance. I was a runner, took good care, ate well, all that stuff. But like many Vermonters, my life circumstances suddenly changed. And I'm not alone with this story, I realize that. In August 2009, at age 40, I was diagnosed with late-stage ovarian cancer. The toll that this illness took made me unable to work full-time, which I wanted to continue to do, which meant losing my health insurance. I wanted to stay involved and work part-time, but knew that it would price me out of state health care programs like VHAP and Catamount. Facing no other choice, I quit my job and enrolled in VHAP, which luckily covered much of the treatment and tests that I needed to try and stay healthy. So luckily that worked out. Fletcher Allen was very helpful. During the period of my diagnosis, my mom's health was also in decline. She had uterine cancer and she was being treated in New York City. Not only was I stressed about my own diagnosis and facing the reality that I was losing my mother, but we both had to fight the insurance system to make sure that our care was covered. I had surgery in December of '09. In January, my mother's health took a turn for the worse and was in the ICU. I wanted to spend time with her in New York City, but was in the middle of my own treatment. I tried my hardest to schedule my chemo at Sloan Kettering so that I could be close to her, but they would not accept my health insurance. A private oncologist down there, my mother's oncologist, said, well, we could do it for you, but it'll cost $10,000 for one treatment. I said, no, can't do that. So as a result, I had to leave my mother and my family just for 2 or 3 days, but it was one of the hardest things I've ever done, is to leave her in the ICU with tubes in her, it was bad, tubes in her mouth, she couldn't talk, she knew I was there. I said to her, I'm leaving, I'll be back in a few days. Stay alive, please. So I flew back to Vermont, got my treatment. My oncologist was wonderful and very sympathetic and knew there was nothing he could do to help me get treatment down there, which we tried to do. My social worker tried to help me. My nurse tried to help me get it down there. Couldn't work. Throughout this experience, I'm fortunate to have a team assigned to me at Fletcher Allen. They've helped me with health and related insurance issues in a big time. But I have to wonder about how many people throughout Vermont don't have this kind of advocacy. I know they don't. And luckily I have had it, but it's also still, even though I've had it, it's been extremely stressful. I've had my social worker, the healthcare ombudsman, I like to say ombudsperson, all had to advocate my treatment being covered. All of this money could be better spent on patient care and my nurses, doctors, social worker, and I could be talking about staying mentally healthy, physically healthy, and get the emotional support that I need. But instead, constantly on the phone with people that customer service representatives who you get frustrated with, and it's not their fault. You know, they're wanting to help you, but then you're like, I need to speak to a manager, and then they get frustrated, and I'm sure many people know this, and it's not a very pleasant system. So despite all of this, I still face problems. I forgot to fill out a piece of paper, and many of us know what those papers are. They come to you from VHAP or Catamount Blue almost every day, every other day, and you look at these papers and you go, and I forgot to fill out a piece of paper. This was last year, so I lost my coverage. So I panicked. And I thought, I have chemo, I have all this other treatment, what do I do? So luckily, with the help that I had, I was able to re-enroll and get the care. But the health ombudsman was wonderful, but she said, you didn't fill out this piece of paper. And I said, I know, but I'm getting chemo and my brain is not, you're not thinking clearly. So luckily, I got back enrolled, and that was okay. While I'm grateful to my oncologist, his schedules are about 7 minutes. So as many of you know, you go in, you see your doctor, I start feeling badly that I'm asking questions, which is crazy. Here I am, I've got cancer, I want to know this, I want to know that, drive them crazy, and they should have the time to listen to me make them crazy. And they don't. And it's not his fault. I'm constantly filled with questions about my treatment, and I don't think anybody should feel guilty about the time that they spend with their doctor. And I want to repeat that it's usually not the doctor's fault, but you take on, or at least I take on, knowing that they kind of glance down or they're standing towards the door, because they know they have another patient to see who's in just as much need as you are. Okay, I'm almost done. The bottom line for me and thousands of others is that whether you have money or you don't have money, whatever your circumstances are, you shouldn't have to worry about whether you're covered, whether you have health insurance. Under Green Mountain Care, our new single-payer system, this fear and stress will go away. And Vermonters will be able to rest easy, knowing they're covered whether they get sick, lose their job, spouse, or other life-changing circumstances. Because as many people know, when you're stressed, everyone around you gets stressed. And if you have a partner, that makes it's very difficult. They watch you suffering, and it becomes a sort of a whirlwind. Unfortunately, my cancer has returned. And just yesterday, I spent about 3 hours, and I'm glad I don't have a job, because if I had a job, I probably wouldn't have been able to do this. I spent 3 hours on the phone with VHAP, back to Blue Cross, back to NYU Cancer Center, and let's see, my nurse, and a few other people, some friends, and discussing how I was going to cover this next piece of trial down in New York City. Because my VHAP, I had to switch to Blue Cross Blue Shield, the Catamount Blue. And when I spoke to the health ombudsman, she said, make sure that they know about the Green Mountain Care when you speak to Blue Cross Blue Shield here, because they may not take that at NYU. And I was like, but I thought it was the same thing. I thought Blue Cross Blue Shield of Vermont and Catamount Blue were the same thing. She said no. Thankfully, I had her to sort of direct me to my next phone call. And that was about 2 or 3 hours on the phone yesterday. I missed my art class. Very upset about. So now my next step is going to NYU for a clinical trial, which is very difficult to get into. Although the research hospital will foot the bill for the medical, my current insurance plan won't cover things like blood work, CAT scans, physician's charges, things I would be getting in Vermont. But this is my last chance at making it through some of this. So bills or not, I will pay out of pocket if I have to, but as we know, paying out of pocket can take years and years and years and years off your life. So I will move forward. Coverage restrictions, out-of-pocket expenses, paperwork, and processing are the result of our current healthcare system and have kept many of my friends, strangers, colleagues from getting the care they need. What I've realized is that until you face a lot of these challenges, you don't take action, which I know thousands of people do, thanks to Cassandra Geekus and many others. People do go and they take charge and they try to make changes. And for me, it was now seeing my illness, my mother's illness, that has led me to see how much more broken the system is than I actually thought when I did know it was broken. So, thank you to the governor, legislators, and advocates who passed this law, putting us on the path to a publicly financed universal health care system. It will make all this difference in the world to Vermonters and their families, whether they are sick or healthy. And we are all just one test away. Thank you.
Julie Lineberger is a business person in Windham County, an architect, and chairs the VBSR board. Thank you, Julie. All right. Come on.
Vermont, once again, is leading the nation in its tradition of independent thinking. We've done this many times before, with being the first state in the nation to ban slavery, to incorporate universal education, to enact civil unions, and then have marriage equality without a judicial order. We're also one of the first states in the nation to enact a socially responsible charter so that businesses can incorporate as a for-benefit corporation. Truly, this law we're signing today is more than a health care law. It is economic development for the state of Vermont. With an equal playing field, Vermont businesses can play on the global marketplace. When our businesses no longer need to spend 15 to 30% of their payroll on health insurance, we can invest back in more Vermont employees and higher wages. Vermont also leads the nation in a very special business organization that believes our success is measured not only by the dollar, but also in how we treat our employees, how we interact with our communities, and how lightly we walk on the earth. With over 1,200 business members, Vermont Businesses for Social Responsibility represents approximately 15% of our workforce. We are the largest, most active business for social responsibility in the United States, leading the way for others. As VBSR board chair, I am honored to be speaking today. For 20 years, we have it in our records, VBSR and a multitude of people have worked to decouple health insurance from paychecks. Who is it that decided that only those working for certain companies were worthy of proper health care? The law about to be signed is a culmination of many people's efforts. It's an example of how governmental bodies, nonprofit organizations, and leading the pack, businesses can work together to affect positive outcomes. Our nimble state of Vermont is making changes where other states waffle. Thank you, Governor Shumlin, for your vision, foresight, and commitment. Thank you, Dr. Deb Richter, for your endless, tireless energy and moving to Vermont, where one person really can make a difference. Thank you to all House Committee members who worked for balance to bring this to the floor under the leadership of Mark Larson. Thank you, Senator Claire Eyre of the Senate Health and Welfare Committee, leadership bringing this to the Senate vote. Thank you, House Representatives, and your Speaker, Shap Smith, for starting the ball rolling. And thank you, State Senators, and your leader, Pro Tem John Campbell, for guidance through the Senate. This business community applauds you. The nation is watching you. With this law, you sure have created a lot of hard work for yourself, and everyone here is ready to roll up their sleeves and help.